So welcome everybody. I'm Russell Roberts from Charles Sturt Uni, and I'm representing and chairing this session on behalf of Equally Well and the Equally Well Alliance. I'm really excited to be presenting the Keeping Physical Health on the Agenda from Vicky and Jade, and I'll give a proper introduction to them in a minute. Before we do that, just a little bit of housekeeping, just to note that we are recording. So if you're uncomfortable with that, you can go in and sort of, with the Q&A, not identify yourself and anonymize yourself, but just to be aware that we are recording this, and this recording and the PowerPoint will be available on the website, if not this afternoon, tomorrow. In addition to that, I just want to say that we will be going through and flagging. There'll be opportunities for questions. So in the Q&A box, so if you hover your mouse down the bottom of your Zoom screen, you should be mostly familiar with this now, you'll see the Q&A. And if you want to put any questions to Vicky or Jade, or the general community who's online, type that in the Q&A box, and we'll keep an eye out for that. I'll keep an eye out for that, and if we've got time, we'll put those to Vicky and Jade, and if not, they may even respond out of session to that as well in our dialogue box. We're planning to go for around about an hour or so today, and depending on how much Q&A that we've got. So let's get straight into this. Today's webinar is from the ground up, keeping the physical health on the agenda. You know, I'm really, really excited about this presentation because it just highlights so much of the ethos and what Equally Well is about. Vicky and Jade come from Flourish, the community-controlled organisation, and Neami, another community-controlled organisation, working together in the same room, God bless them, socially distant, God bless you again, but together. So, you know, it's such a great example of working together, which is not always that common in this competitive grant environment of the NGO and community-controlled organisation world. But more than that, you know, they're partnering with public health services, you know, right across New South Wales and Australia, and they're partnering with universities to do the research. And most importantly, and this is what I'm so excited about today, is they're partnering with people with a lived experience and partnering in sharing and giving them power over their recovery journey. So all of these things are just so much about what Equally Well is about doing what you can, where you can, and doing it together. And so this is just very exciting to me. I need to give a big shout out to Arthur Papsagotzius, the previous chief executive of Neami, but also to Tom Dalton, you know, for the continuing support and innovation, and also to Mark Orr at Flourish. Once again, I think in public health services we are we struggle to be as agile and as innovative as the community sector. And I think what we've got today is a great example of the community sector leading public services, not only in Australia, but quite frankly, internationally. So with that little bit of a rev up, Vicky and Jade, I'll just introduce our speakers today. Our first speaker will be Jade Ryle. Jade is a proud descendant of the Wiradjuri people, and she has a background in occupational therapy and a lot of work within community of practice and working in community mental health. And Jade is just full of generosity and of spirit and enthusiasm, and that already the impact that she's had on a number of public services, public mental health services, state mental health services across Australia is profound. So, and it's just going to amplify, I'm sure. Vicky Langan is a sports scientist and has experience in public health. And a lot of experience in mental health first aid in the community sector as well. And originally hails from Ireland, and I can listen to Vicky's lilting accent all day, but don't take that as an invitation. You have a strict time limit today, Vicky. So on behalf of Equally Well, I want to welcome you and thank you so much. And over to you, Jade and Vicky.
Thank you, Russell, and to the Equally Well team for inviting Vicky and I along today to share a little bit about the work that we're doing in the physical health and wellbeing space through our community managed organisations. and for your very complimentary introductions. So I'm just going to start by giving everyone who's attending today just a bit of an overview of the webinar, and a big thank you for joining us and taking the time out to listen to what we've been getting up to. So an overview, we're going to introduce and provide an overview of the community managed organisation's role in preventative health. We will highlight what we bring as organisations and the shared values that really drive the support that we offer. And then we'll each introduce the approaches that our respective organisations have taken to support people to improve and maintain their physical health. And we will finish on a where to from here. Vicky and I are really hoping that today's webinar will be the future, the beginning of future collaborations and partnerships amongst those who are attending today, and wider services beyond. And throughout there'll be some time for questions too, which you'll be able to manage, Russell. So I'm going to hand everybody over to Vicky, who's going to give an introduction and an overview of the community managed organisation's role in preventative health.
Hi everybody and welcome. So look, in most recent years, CMOs have become sophisticated and display unique practice in their approach to preventative health for people living with a mental illness. I suppose being part of a person's day, week, month, year, we are required to be specialists in person-centred care. And through innovation, consumer participation, and of course co-design, as we mentioned, CMOs provide services created and developed from the ground up, and hence our title today. By building relationships with the people we support, giving way for better communication and informed decision making. So placing whole of life at our core, both Neami National and Flourish Australia have invested in physical health and wellbeing processes and supports that will increase the life expectancy of people living with a mental illness and improve quality of life. And we will talk, and you will see a lot of that today when we talk about the offer as part of a holistic approach to consumer care. This includes early detection, of course, and intervention through physical health assessments. And we both will talk about different physical health assessments here today. Supported referrals, absolutely. And a focus on prevention through health promotion, education activities, and targeted health interventions. And I suppose CMOs are, you could call us specialist public mental health services. I suppose we're giving ourselves that title. But you know, when I went recently looking at all the recommendations and the reports, and coming from Victoria, coming from New South Wales, on improving the physical health of people living with a mental illness, we really do, as CMOs, meet all of those recommendations. And again, you will hear that. Like just one recently from the Ministerial Advisory Committee on the Mental Health Report from Victoria. And they talk about contributing to reducing the prevalence of common physical health problems and associated risks. Yes, that's what we do. Work more effectively with mental health sector organisations. Well, that's what we're trying to do, and here we are today. And establishing chronic physical health disease management programs for consumers with severe mental illness, and assessing where we are and how we can improve on those. And that's continuous for CMOs. And a lot of what we do needs to be evaluated and needs to be, you know, proven, and you know, we have to make sure that yes, it is of value and it works. So you know, that's what we're doing. And also to develop targeted health interventions and health promotion, and to encourage positive health behaviours, self-management, and reduce common risk factors. And so this is coming from the Mental Health Report from Victoria. And just to let you know that that's what we are, CMOs, that's what we are doing.
Okay, and so I'll just touch on in a little bit more detail what Vicky's just introduced there by describing what CMOs bring and the values that drive the work that we do in this space. So the things that are really important to us. We are obviously person-centered, meaning, and our definition of that is that the person is at the centre of the discussion and is the focus of support planning. And as Vicky said, it's a whole of person approach. So we're really interested and focused on how the person sees things from their point of view, what meaning they place on their health and well-being, and importantly, focusing on the things that will influence the person's physical health and well-being in ways that will be helpful, and understanding the things that are not so helpful for the person. We are person-led in our approach, where the person makes decisions about their healthcare and arrangements. They determine the direction that they'll take in managing their own physical health and well-being. We focus on relationships. Relationships are really central and crucial to the work that we do. So getting to know the person and each other is a really important first step. As Vicky said, we are often in a position where we are able to build a relationship up with someone over time. And so often seeing people daily or weekly, and that regular connection and check-in really does help to foster and build a trusting relationship with the person that moves beyond just the here and now, but also helps us to learn the journey that the person has been on to get to this point, and where the person would like to continue to move through to. Lived expertise. Both of our organisations, acknowledge and value and privilege the unique perspective that people with a lived experience bring to the support relationship, including families and carers. And we listen to the lived experience, and it helps us to shape with the person what our services and supports look like. So when Vicky talks about, from the ground up, being led by what people say that they need and will be most helpful for them. And it just makes sense to us that those who the programs are designed for and designed to serve will have a voice and will have an opportunity to guide what those services will look and will feel like. Communication. Communication and strong communication is another key focus for the way we provide supports. And at the core of all of that is communication. It's about opening up a dialogue. So it's not a one-way conversation, and it's a dialogue with the person. It's strength-based. Our language and the communication is supportive and it's encouraging. It's hopeful and it's always respectful. And through these open and very exploratory conversations and approaches, we begin to develop an understanding of, what the person sees that they need, and in their words. And so talking and learning about what works for them and what they'd like to change. So we don't assume anything, but rather ask questions that help us and help the person express themselves and what they need. Collaboration and partnership that we've spoken about already, but we collaborate and partner with health services and other institutions like universities, for example, We do recognise that the collaboration and the partnerships that we form are ways that we can enhance the services that we offer to people. We know that working separately, potentially limits our collective capacity to support people. So collaboration and partnership is central. And innovation, we've talked about innovation a bit earlier, but how do we translate what people tell us they need in order to manage their health and well-being? And at times we need to be innovative, and that comes from identifying gaps and responding to gaps in service provision, and to improve and constantly be trying to improve the way we do things so that they're more effective. And so we do that through the co-design and co-development of resources and programs, which we'll talk about, that are specific to the needs that have been identified by the people who access the services. And I suppose, I'm talking about challenges. People do share some of the challenges that they face in, navigating our health system and managing their own physical health. Stigma and discrimination is a major challenge and barrier for people to access and self-manage their physical health. And just according to the National Stigma Report Card from SANE Australia that came out a couple of weeks ago, stigma and discrimination within healthcare services was actually identified as the third most common concern among participants of that Our Turn to Speak survey. And so that actually accounted for close to 84% of all participants reporting some level of stigma and discrimination in healthcare services during the past 12 months. But there are other challenges that people share with us, such as having confidence and self-esteem, knowing what's available, who can help, what to expect and what to look out for, costs for services. And so we hear those things and we work hard to co-design and co-develop resources that will respond to that need and reduce the impact that those challenges are going to have on that person managing their physical health and well-being. And so Vicky is now going to give some examples and an overview of all the great work that Neami National is doing in this space to demonstrate how we're doing all of those things.
Okay, so hand it over to me. So I'm just going to talk to you about the New South Wales Health and Wellbeing team and how we fit into this picture. The team comprises of myself, the New South Wales Health and Wellbeing Manager, alongside, and I oversee a Health and Wellbeing Officer. I also oversee the Activate team, which I'll talk about Activate in a little while. And the Activate team consists of a project leader and 2 peer health coaches or peer workers, and also the New South Wales student coordinator. You might think that's a strange one, but you'll hear why that fits really well. And also I oversee and support the peer support network leader. So it's all, I suppose, a big picture. I've plenty of hats, but definitely they all come together. And one of the things at this team, I suppose we work from a strength-based recovery approach, which fits really well with Neami's collaborative recovery approach and coaching, and really to promote physical well-being and resilience, as well as physical health education and for both staff and consumers. And that's something that you will see along a theme in relation to that, I suppose, parallel process in that staff and consumers. So it doesn't work if they're not both supported and educated equally to be able to do the work. This team is responsible for a lot. So I just to let you know, so it's planning, development, implementation, evaluation of health promotion activities, including health education, community development, community engagement processes, advocacy, lobby strategies, social marketing, social media, health policies, and environmental strategies. So I'm just going to move to the student coordinator and why that's there. I suppose, with a targeted process to act on physical health opportunities, we utilise the likes of student placements at Neami. And these students consist of different disciplines, such as nurses, OTs, oral health students, dietetic students, public health students, and many more. I'm really naming the physical health side of things. We do have a lot of social work students as well. But more, you can see here, in 2019, 20,000 hours were given by students to service delivery in New South Wales. And what they brought, I suppose, was their expertise in supporting physical health initiatives. So they contributed to help with the development of our physical health programs, and also to implement those programs across all of our services. One of the other things then, and you see here at our core in our New South Wales, are consumers. And they have been and always will be the centre and to the development and implementation of our programs by this team. So we've had over 60 consumers, and I can tell you now that that's an old figure. It should be new, but I could count another probably 20 to add on to that have participated in co-design very recently. So it's quite phenomenal, really, and that work then is supported by the Neami Consumer Participation Framework, which is a fantastic piece of work and supports us to be able to be inclusive. I want to give you an example of a co-design process. And one excellent example of a co-design resource was the development of the New South Wales Conversations, a guideline supporting conversations about medication and treatment, and also a comic that came out of that, which was basically the whole process of how it happened. And that comic is available to just have a look at and see what the staff were saying, what the consumers were saying, and what came of that and that whole process. But the resource and the process have influenced culture change, and this is one of the big things for us as well. Is that culture change within an organisation, with among the staff and consumers, especially around the medication, but also not just me, my staff, for external partners regarding their role in supporting consumers with medication specifically and embedding it in their practice as well as our practice. I have other examples, but that's all I can manage today. So you can contact me for other examples of really good co-design. So the key objectives for ourselves in health and wellbeing in Neami is to ensure, of course, co-design and also to empower our consumers and our staff. And that's really important, and we see that with the health prompt and educating our staff to empower them to be able to come forward and support the consumers where they need to be supported. Improving access to healthcare. Absolutely, we're professionals in our own right, but we need to support our consumers into the professionals in the primary healthcare services, and that's what we're here to do. We're professionals in that, as I said, in that right. Improving the quality of life, and of course we can do that. Consumers can do that for themselves. Prevention of chronic diseases. Which is what we're aiming for. Educating all parties, not just the consumers, not just the staff, but externals, and also the community. Educating the community, and Jay just spoke about stigma. Well, we need to reduce that. We need to eliminate that, and that's our role as well in the health and wellbeing team. Building capacity of all parties, and of course improving and this is like overall health literacy. Okay, so I suppose another huge part of our role is we're moving on to is partnership and collaboration. So for Neami, and I'm talking about us specifically, over the past 3 years we've worked, and I say 3 years because this is in New South Wales, and it's only the time I suppose I've been in this particular role as a manager. We've worked to ensure strategic alignment with many with the mental health sector and implementing recommendations, as I spoke earlier about when we're talking about CMOs. But for Neami, we've really looked at the New South Wales health guidelines on physical health care of people living with a mental illness, the guidelines from the World Health Organization on the management of physical health conditions in adults with severe mental illness, and of course Australia's Mental Health Commission, the 5th Mental Health Plan, and taking into account considerations on the most up-to-date research and recommendations from the peer movement and academic papers and journals. But of course, one that came out, I suppose, last year was the Lancet Commission, a blueprint for protecting the physical health of people living with a mental illness. But not only this, we also work alongside stakeholders, and we need to continue to in order to provide their service. And we know that they add value to the health and wellbeing projects for Neami and our initiatives, but also contribute to Neami's service provision and to tender applications or tender opportunities, enhancement of community mental health and the physical health and research. So you can see here we have the Cancer Council in New South Wales. We worked fantastically with them over the past 2 years. The Australian Dental Association, New South Wales Health, our PHNs in different locations, you know, University of Melbourne, you know, and we worked nationally with University of Melbourne and University of Sydney. And I should be putting Charles Sturt University, sorry about that there, Russell, but it does come up later. Okay, so look, I just want to introduce you to health programs that Neami are working on, and you'll see a lot here. Don't get overwhelmed, just have a little look through the list. But I'll be picking out a few today. Probably, I think there are 3 I'm picking out today that I will go into just a little bit more, I suppose, an overview of them. Again, there is a lot more to them. You'll only see the bare bones. But look, the good news, this is the thing. So I suppose we can demonstrate that we are unique and that we, in our practice, and essential to the jigsaw. And this is why we have our jigsaw here. We are community mental health organisations, and Neami are essential part of that. So the good news is that many of the prevalent chronic diseases that are recorded with our consumers living with a mental illness can be influenced by lifestyle behaviour and can be prevented through screening and early detection. So, I mean, we're bringing the good news. Can be managed through ongoing support from the CMOs and the primary healthcare services. And they do require lifestyle modifications and can be achieved through education, support, and those behaviour change programs. So let me first take you here to the health prompt. And I hope you can see there at the top, Neami's physical health prompt. Let me just get back to where my notes are. Here we are. So the health prompt is a backbone. I suppose this represents, a backbone, if you could say that, of Neami's health and wellbeing program. And it's vital to the first step of consumers identifying what their physical health issues, what physical health issues they may have, they have not known about, or that may need attention or treatment. And then just to show you, in 2018, 2019, so in a 12-month period, in New South Wales, the staff, we completed 646 health prompts with consumers, and nationally was 1,697, and that's only in 12 months. So there's been thousands completed since its inception back in 2014. So look, I'm just going to share a story with you here. That was on behalf of the consumers. They wanted to bring that, you know, as consumer feedback. And here are some quotes from consumers of Neami services that have completed the health prompt and then participated in our health prompt review. And consumers reflect on their experience with their GP and their satisfaction or lack of satisfaction around their medication. Consumers, conversations with CRSWs about the GP supported them to either change their GP because their needs weren't being met, or to or supported the development of self-advocacy to be able to talk to the GP when seeing the GP. And so I will read these here for those who might not necessarily be able to or see. I should have had my glasses on myself. Consumer feedback. So it's the health prompt did prompt me to think about my GP. They wanted to keep me on the same sort of medication that I was on for 10 years. They weren't hearing me and they were discounting it. But now I have got a regular GP that has been the best GP I've had in my life, which is absolutely fantastic. And that consumer can now take ownership over their own physical health. And this one is really just about a behavior change and identifying that there is other choices out there. When a consumer, rather than going to the cupboard and taking out lollies, they're now thinking about, hang on a minute, I have a choice here. And that's from conversations with people, with their CRSW, and then knowing what would be the good choice to go for. Okay, so look, the overview, some of you might have seen the webinar last week, or not last week, I said that again, sorry, a month ago, in relation to the health prompt when Steve Sutty was presenting. So I'm just going to give you a brief overview of that health prompt again, maybe in a little bit more depth. You never know. So firstly, why was it developed? And of course, we've all seen the data. We all know, the reduced life expectancy of the 15 to 20 years. We all know that. We know the decline in the physical health of our consumers, and that was specifically why of the Neami consumers would see the decline in their physical health, and that basically our consumers are dying younger, and they're dying of purely physical health issues. And so that's why it was developed. What is it? Well, it's actually a physical health resource tool, co-designed to reflect a strength-based and recovery-orientated and holistic approach. And let me just say to you, it's not a metabolic monitoring assessment. It's not a medical assessment. It is a conversation resource tool to get that started, to get people to having that conversation. And that's where it starts. It starts from the ground. I suppose the questions that are in there, they're from national recommendations, absolutely. They're from national recommendations around screening, around administering, and around consuming. And this is completed every 6 months or 3 months, depending on the needs of the consumer. The generic version has 28 questions. They're yes, no, or not applicable to me. And there actually is also a body chart. I put that up there. And the body chart allows for people who may have literacy issues or have a different language background to be able to identify where on their body they might be experiencing pain or have an issue with, and then you can have a conversation about why it was that you ticked that particular place. So here's some of the questions you'll see in front of you there. So they're very hard to see on the large one, but and again, the strength-based. We're not asking, are you a smoker, and pointing the finger. It's a case of, are you a non-smoker? So we're celebrating the fact you're a non-smoker. Are your feet free from sores, blisters, and swelling? Do you have a regular GP? But not only that, are you satisfied with the relationship? It might be great to have a regular GP, but you never talk to the person. You have them for 10 years and you're not talking to them. That's not going to help. What else we have is a set of guidelines. So the health prompt, guidelines for staff. So staff receive training. And you might think, oh, well, all you need to do is give the person the prompt. Yes, you can, but it really is important to have that coaching conversation, to have that belief, to celebrate the yes answers, and maybe then look at the no answers. To build it into practice, it has to be best practice. So how do you build it into your current practice because it will look very different in a community mental health setting as it would in a clinical setting. It might look different in a residential setting, so you need to have that information. And then the guideline also gives you information about where to go to get further information, how to support the consumer to access online information, books, readings, services. So it's really a really good guideline for you as a staff member and to be able to support the consumer. And then, but the other thing as well is that I suppose the aim of it, and I don't want to miss the aim. The aim is to increase that regularity of physical health checks and the quality of the physical health checks. You can go in and have the check for the individual, can go in and have a conversation with the GP and say, oh, yeah, I need to have my cervical screening done. But the thing is, do they know what a cervical screening is? Do they know what it's for, what it means if the results come back different or good or bad? And that's where the worker comes in to have those conversations, but also the GP. So that's why it needs to be quality and regular. It increases the individual's awareness of health issues and the checks, so they know about the checks. The individual's own self-management, and that's what we saw in the quotes. The confidence of the staff to provide physical health information and interventions. And then they can provide those referral pathways to community links, nutritional, educational, emotional, psychological supports. And I tell you, there's been a need for innovative space for the health prop since its inception. And you know, it's also important for us to build it into tenders when we're applying, to say, look, we have this fantastic tool that we can do with consumers and support them to look at their physical health. So hence the body chart was one of the innovative thinking, but also it's available currently in Somalian and Mandarin. And if there's any other language that we're missing, of course we will look at doing that. What else? It's available in, we've got a youth health prompt, youth specific. Even the front page of this is different, and that was an art competition from a youth residential services, and that's where it was created. Excuse me. We've got the pictorial health prompt, and this is derived from work that we conducted in private boarding houses with residents. And we did some work with these residents on individual capacity building and to support them to look at NDIS and looking at their own physical health. And what we saw in there was that 64% of the residents in the private boarding houses had literacy issues. And what we had in 28 questions was just not going to cut it. So we asked, how can we better support you to identify what might be an issue for you with your physical health? And yes, the body chart helps, but then we had to look at a pictorial, and they participated in that. I actually have a copy of it here, and this is it in its form. And we have some of the consumers in there, in relation to that wanted to be in the book. And identify pictures. So, are you a non-smoker? You know, and you get to keep that. It's tangible. If you own it, you can take it away with you. You can bring it, and you can bring it back the next time, and we can talk about it. So it was a fantastic resource. But again, it was a generic version, and we saw a need again for special populations, and we've recently. It's in the design phase now at the moment. Is the Aboriginal and Torres Strait Islander health prompt. And again, that process was very different, believe me, in regards to what questions should be in there. See those pictures, take them out, that is not relevant to me. We actually did the co-design in a national forest with Aboriginal and Torres Strait Islander consumers, and came and we did a fantastic bushwalk. And during that time, we looked at the questions and we spoke about it. And this is one of the pictures that was taken there, talking about the feet and looking at all of our feet. So yeah, it was designed very differently. We're looking forward to that coming out. And of course, we have, and it's not up here because it's at the moment going through a printing phase, but we're working on an older person specific physical health prompt. I do have a sneak preview of that, if I can find it. Yes, it is. And again, at the moment, it's only in the question phase, but it does look significantly different. And why? Because, well, writing is much bigger. There's no longer 28 questions. There are 37 questions. And the body chart has a back and front, but it's specifically around talking around pain and discomfort. So there are differences, and that process was fantastic as well, bringing in older persons to do that. So we'll be piloting that with New South Wales Health, the Older Persons Mental Health, and Charles Sturt University. Okay, so I'm going to move on to another example of work that we're doing in Neami, Health and Wellbeing team. Sorry, this is there is a prompt, not a prompt, sorry, there is an app for this particular health prompt. And we did do a couple of phases at it nationally, but like it does and happens all the time, is that we didn't have enough funding to be able to complete it. So yeah, it's another project that we definitely would like to follow on and work on. So I'm just going to bring you now, so we're looking back again at the, on the right hand side there, you see the programs, and one of the other programs that you will identify there that I have is our Smile for Health program. And this is a national program that was developed with other health promotion officers, and it was actually the University of Melbourne. We came together and put this a lot of resources together. But what I want to also draw your attention to is a long time ago, I suppose, back, I can't remember, 10 years ago, I as part of a network that I sat on in the Inner West, when it was Medicare Locals, I sat on an Inner West network, health promotion network, and I met a few people there, and from that we developed a fantastic partnership that still exists today with the Australian Dental Association, and that has gone from strength to strength. And for Neami, over that time, we have been able to refer consumers of Neami services to private dentists for free. So it consists of dentists who want to give their time for free, and they've identified dentists that are, as we would say, mental health aware and have an understanding. So it's been fantastic, and 35, well, I couldn't say more, that's more than that now, it's probably up in the 50s, consumers have been treated more than once, and now they've received dentures, free dentures. So it's been absolutely fantastic. But the reason why we were doing, so looking at this project, was because for 5 years in a row, when we looked at the health prompt nationally and from New South Wales, we identified that in the top two no answers, for 5 years in a row, the question, have you had a dental checkup in the last 6 months, was there for 5 years in a row. So we identified, hang on a minute, there's a trend here. We need to be doing something about this. Why is this happening? Why? These are some of the reasons why. Sorry. And this is changing, but unfortunately, some places it's not changing. There is a waiting list up to 12 months for a dental appointment, and there's no priority for people with severe mental illness. And the other one from a consumer. I'm in a lot of pain and I can't eat much with my ill-fitted dentures. This is what we were hearing from our consumers. So we worked really, really hard with the University of Melbourne, with consumers, to develop a huge set of resources that we could train our staff to be able to support our consumers with their oral health. The other side of it was we had the ADA referrals as well, so they were going parallel. They were parallel and happening simultaneously. And this is just an example of some of those resources that we developed. And the staff have these and are able to have those conversations with the consumers. And again, you know, they're guided to. And we've also received from the University of Sydney, we've had students participate for the last 5 years in a row. With oral health students come from the University of Sydney, do their placement with us, and again go and see consumers and have conversations about dental, have conversations about their discomfort in attending dental services, what they can do for themselves at home, and improve their own oral health. So it's all worked fantastically. So it's very much, you know, really building on what we have. Okay, so let me move on to I suppose almost the final one here. So we've got other ones that we're working on, other things that we really need to do. We've got the Smile for Health, our educational health modules, and what we've done is we've developed these, and this is where the student coordinator, me supervising that person, comes in, and being able to have access to those students. So we've developed modules, which are 2-hour modules that Neami staff deliver to consumers in a group setting, because it's that social connection, that social connecting, and that shared experience and understanding. We've developed one around tobacco awareness, which was developed in partnership with a public health student and consumers. We've got a healthy eating one, which was written by the health and wellbeing team with a dietetics student and consumers. Our oral health with the dental students, and our skin smart with the public health students. And I think we've just completed one, or almost completed one, around medication. And again, we've collaborated with a few people, with some nurses, mental health nurses, and on those. And of course, they all go back to our consumers. They say, I don't understand that, not at all, and we review it. So, and all of these are evaluated and improved on, like, all the time. So that's just another example of work that we do. So finally, I want to bring you to the final program or project, and that project is Activate. So the health and wellbeing team created a program with a biopsychosocial approach, and we called it Activate, consisting of different programs, and there was a reason for that. ePlant Learn, which is a group program in a community, linking people to the community, staying in the community. Coaching for Physical Health, aka, which used to be peer health coaching. So it was a huge piece of work that we did with, say, in Australia back in 2014, and we've continued it and reviewed it, and it's now Coaching for Physical Health within Neami. So it's the Neami program, and that's one-to-one, focusing on physical health goals. And then we've got Kick the Habit, which is again a Neami national tobacco management program that I suppose has taken Sharon Gould's model of consumer-centered tobacco management, and we've used that to develop the program Kick the Habit, and which was piloted actually a few years ago within Neami by University of Western Australia. And you know, again, we just didn't have the funds to be able to implement it, but thank God we did get that funding from a PHN in Southern New South Wales, the coordinator, for 3 years in a row, because this program worked so well.
Vicky, it's Russell. We might get you to sort of, there's such a active Q&A that I'd love us to have a bit of time to respond to. So I might get you to sort of, keep moving along if we could.
Yeah,
thanks.
Just show you Activate, basically. So Activate, we use a health prompt. You have the tobacco program, the Coaching for Physical Health, and the ePlant Learn program. And what they bring, and what I've noticed is, with all the webinars that I'm seeing and hearing and all the recommendations, this is what we've gotten from, and we've seen consumers get the impacts for consumers: social connectedness, health literacy improvement, community engagement, individual identity, building self-efficacy, autonomy, inclusion, not within their own community, positive health behavior change. And this is something that Professor Simon Rosenbaum talks about. And also skills building. So this is Activate, and I can tell you, this is what the results we've seen from Activate. So if you look at this, you can see that 64% of Activate participants had a coexisting physical health condition. As we know, that's what we've seen. I think it was 80% nationally. But we've seen from Activate that 95% of people reported progress towards their goal, which is phenomenal. And we also measure health literacy using 4 domains of the Osborne HLQ. And from that, we've seen a 10-point increase in people's health literacy from attending Activate. And over the 2.5 years, we saw 821 referrals to Activate. But if we look at then the ePlant Learn part of it, we can talk about and see that we had 383 referrals, but I'll tell you that 85% of those referrals actually participated, and that's a 6-week program. 39% saw an increase in their fruit and veg intake, and I think it was 70%, saw an increase in their cooking and food provision knowledge. And we know this because we actually use an evaluation called the Cooking and Food Provision Action Scale, which is the CAFPAS. And the other one then was the Coaching for Physical Health, and that was only introduced in the last year of our Activate program. And we got funding. We were very lucky to get that funding from the PHN at that stage, and we were able to implement that fantastic Keep the Habit program that I was waiting to do for so long. And we got 47 referrals over 10 months, 80% of which reduced their cigarettes, and 91% of them used NRT. And there was 260 individual coaching conversations conducted with those individuals. So Russell, will I just go on and show the video and then that's it? Yeah. Okay. So I'm just going to end my bit here with a beautiful little video. It's a 4-minute from a consumer who participated. I'll leave it to you.
What did you enjoy about the Activate program? I can honestly say everything, and by that I mean it was starting off with mixing with people that have the same problems as I have, having the peer workers, the workers there to direct us and guide us into have a healthier lifestyle, introducing us to a lot of new fruits, new vegetables, new way of cooking. Now I can cook very well, but what I learned here, I'd never come across before, so I was very happy. And as a matter of fact, as I was actually discussing this morning, as I went for a walk with my 2 boys, by the way, they're in their 30s and 40s, and I said I was coming here today, and they said, they were very happy, and I said, why? They said, because Dad, we know there's a big difference. From when you were doing the program, you came out of your shell, you became more friendly, more at ease, you weren't as tense, and what's the word I'm looking for? Anyway, I was a lot happier, and it says, and even you're starting to sort of go back a little bit now, but even since a couple of days ago that I found out I was coming here, I'm cheerful again, I'm chirpy, so I was very happy. Right, how was it working with peer workers? When you suffer with anxiety and depression, it's very hard to associate and talk to anybody. When we came here, as I said before, they made us feel very welcome. They didn't talk down to us, they talked with us. We talked with the other people that were here, like I said, who had the same problems. And by associating with each other, I feel as if I sort of come out of my shell. I can talk to people more, I can go out more, which I have, by the way. I've started to go out with to coffee shops with friends, not often, but I do. And actually, 5-6 weeks ago, I organised a card game with guys that I haven't seen in 20-30 years. And they came over with, they know what's happening with me, and it was really, really nice. And once again, I put that to the peer workers that we had here when we did the course, because they encouraged us to do all these things to know and learn how to live with the problems that we have. And once again, the thing, well, I enjoyed all of it, but including the fact that they showed us different things to cook and how to cook them, and also to show other, we all helped each other, showed us all these different herbs that we could grow, which by the way I still have, and that's quite a lot, a long way away. And there's this other thing that I have, I don't know what it's called, but it's a ball of glass, and inside there's succulents and that, and it's not alive. I mean, I've got a thumb that really doesn't work. So I'm so happy. Yeah, when I have people coming over my house, which is not very often, but mainly family, I'm so proud of showing them this thing. And I said, look, it's still living. So we have a good chuckle about that.
Okay. Yeah.
Oh, thanks, Vicky. Listen, I'll just reflect a little bit of housekeeping. So just so people know, if you go in the Q&A, in order to make it public, I just have to type something. So I'm typing a full stop. Doesn't mean it's the end of the conversation. It's just that I'm escalating it so everyone can see and participate in that conversation, which is a really important part of a collective impact to support one another. Thank you for those people who are putting the resources and the links. That's really helpful. Now, just on that, Vicky, there's a lot of questions, a lot of interest in terms of the opportunities to share this. Before I throw to you, just to mention the Equally Well website, equallywell.org.au, and we do have a list of resources. So what we will do with Lee is any of the ones that we can share, we'll put on the Equally Well website. But Vicky, I might just get you to reflect on that before we go to Jade. And also to mention that there is a number of comments that while Jade's talking, you might be able to respond to as well on the Q&A. But just tell us about the availability. There's a lot of questions about the sorts of availability of the different resources that Neami have produced.
Yeah, so I suppose right now the help prompt is public and has been since we produced it. So I suppose what we were trying to do at one stage was try to keep an account of who was actually accessing it, to see who really needed and wanted it, and how could we support that. And I suppose the best thing would be to do is to approach myself or Neami projects, and just have that conversation. As I said, the only difficult we have, because we're a CMO, would be, and it's always been, is the funds to be able to produce these resources. But we're very happy to, and if there are resources out there that need to be, to have consumer co-design, well then, we're very happy to support with that. So I suppose at the moment, I suppose all would be publicly available would be the health prompt. We are looking at potentially into Activate as well, but that's down the line.
So just to remind people, anything, Vicky will send through anything that is available, and we'll post them on the Equally Well website. But you can also make contact with Vicky either directly or through us, Equally Well. And now I'm just conscious of the time, so I'm going to introduce Jade Ryle. And Jade, I've already introduced you, and so from Flourish, and talking about the Back on Track Health and some of the resources that you have. So I'll just let you change positions in a socially distant, appropriate COVID fashion, and over to you, Jade. Even though the screen says Vicky, this is Jade Ryle who's now talking to us. Thanks, Jade.
What did you enjoy?
Thank you. Thank you, Russell, and thank you, Vicky. Can you hear me okay there?
That's fine.
Great. For those who aren't familiar with Flourish Australia, we are a community-based, not-for-profit mental health organisation, and we've been providing sort of practical supports for people with a lived experience and a mental health issue, as well as their families and carers for over 60 years. I manage Flourish Australia's Back on Track Health program, which is also known as the BOTH program. And the BOTH program was established back in 2010, around the same time as Neami National embarked on their journey too. It was developed because the organisation recognised that there were inequities in health outcomes for people with a lived experience of a mental health issue. So a large gap in life expectancy, reduced access to primary preventative health supports, high rates of chronic health conditions. And that those major chronic health conditions that people were dying early from were largely preventable and can be preventable if we all work together. So, so in response to this, we developed the Back on Track Health program, which was an organisation-wide approach. It focuses on health promotion, prevention and self-care, or physical health self-management, as well as promoting personal agency, so supporting people to really develop their sense of responsibility for and control over their health and wellbeing needs and the outcomes. So a focus of the program is supporting people to build their skills and their capacity to self-manage their ongoing physical health needs. So the specific aims of this program are to identify and access preventative health activities, such as finding a doctor to talk to about their physical health, visiting the doctor regularly for recommended preventative screenings and health checks. It aims to support people to identify and detect health risks early. So raising awareness of the things that you would that are important to notice about your body and changes in your health that might indicate that you need to see the doctor and get it checked out, or notice something that you'd like to talk to the doctor about. It supports people to access information, reliable and accurate information, so that they're able to make an informed decision about how they'd like to manage their health and wellbeing. And of course, to take action. The approaches that the Back on Track Health program take really aim to support people to take action and respond to their physical health and wellbeing needs when they notice a change. So I'll just go through just quickly some of our approaches, and I'll go into more detail on just some of them for today. We have individual, group and community and organisational approaches to health promotion, health prevention and self-management. So some of the individual approaches are things like our physical health check-in, our physical health cards resource and our physical health website. Some of the group and community programs include our quarterly physical health promotions. We have a panorama magazine that features stories of people's journeys towards managing their physical health. We have Yammer, which is a bit like our organisation's version of Facebook, which provides like a community of practice where staff can get in and share information, different training opportunities that they've seen. Another group approach is the physical health focused group programs that are offered in some of our services. So that might be, food and nutrition groups, walking groups, and gym groups as an example. And the next is organisational. So the policies and processes that we have in place in the organisation are there to support us in delivering and facilitating all the activities that the BOTH program has developed. So a good policy and process so that we're able to achieve those aims. And of course, partnerships. So our approaches are to partner with other organisations who can really help us expand, the evidence base for what we do, and evaluate what we're doing and make improvements to improve the effectiveness. So I'll go through some of these today. I'll go through the individual approaches and I'll cover some of the group, and if I've got time, organisational approaches. But the first thing that I'll introduce is our health check-in, our physical health check-in conversation. So this was introduced in January of 2019. And this is a conversation that focuses on just the key preventative health activities, or the things that people can do to keep their health on track. So within the organisation, it's every support worker's role, if they're providing direct supports, to hold a health check-in conversation with the people that they're supporting. And so every 6 months, a time to get together to have a health check-in conversation is offered, and that's where there's an opportunity for people to reflect on different questions and talk with their support worker about preventative health activities that they may be due for or overdue for, or would like to connect with. There's some pictures up there to give you a bit of a clue as to what's included in the health check-in. So some of the questions are, do I have a regular doctor to talk to about my physical health? So, certainly similar areas, teeing my national, because talking to a doctor, as Vicky has said, is one thing, but finding a doctor to talk to about your physical health is very different and can be very different for people. Have I had an annual health check by a doctor? When was the last time I had my medication reviewed? The check-in explores smoking. So if a person is currently smoking or currently attempting to reduce or stop, it's an opportunity to seek information or support, and for us to ensure that those who do seek support find that. There's questions around dental health, the last time the person's visited the dentist, their participation in different physical activities, so the different types and the frequency. And there's a question there about whether I've been referred to or recommended to see another health provider, like an allied health service, so maybe a dietitian or an exercise physiologist. And the important follow-up question from that is, if I have I made contact or attended an appointment? And so based on people's responses to that, it really guides the conversation that we have with the person. So to date, there's been 4,936 physical health check-in conversations, which include, 6 monthly reviews as well. And so those conversations have been held with 2,921 individual people who access the service. So that's the number of people who have reviewed some preventative health activities that they might be due to receive or would like to connect with. We do have some other resources to support that conversation. So we have the physical health check-in information sheets, and each of these sheets just provide a brief overview of what the preventative health activities might involve, the potential benefits of any of those things, who to contact, how to make an appointment, and what supports we can offer. So there's an example there on finding a doctor. So some of the things that you might look for in a doctor and that you might consider when you're searching for someone. Having an annual health check, so what does that include? What could the person expect? What could be some of the things that they might find out about their health if they were to talk to their doctor about that? Medication reviews, so what the purpose of those are, but again, potential benefits, where to go, who might be involved in that, and how they can arrange for an appointment. And on the reverse of that one, actually, there's just different questions that people might like to think about in terms of their medication reviews and ask when they next see their doctor. And of course, smoking cessation, so linking people to support services if they do identify that they would like to reduce or stop, that we've got that information there. We also have a health check-in conversation guide. And this guide provides information and ideas that will really encourage an open but focused conversation between support workers and people accessing the service around their health. So the process is really about both people sharing information and knowledge and experience between each other, exploring what that might look like and what that means for the person, asking if people would like to find a doctor if they don't have one, if they would like support to have an annual health check. So we ask that question, and then very importantly support the person to identify what actions they might like to take following the conversation, if any. I'm going through this because I'm conscious of time, but I can always answer questions after. So I'll just move on to the physical health cards. And so the physical health cards have been designed to support the early detection of health risks. And it's quite a visual and a tactile interactive tool, and it supports people to review their health, notice changes, and raise awareness of what changes to look out for in the future. I'm just putting up there on the screen just visually some what they look like. And so there's 4, but there are actually 33 health topic areas that are covered by the cards, and they include a whole range of aspects of our health and wellbeing that we may not necessarily routinely think about or consider. So there's some examples. Each of the 33 cards on the reverse side will feature a list of reflective prompt questions. So you can see those there. And they help us to look for the things that might indicate that, a chat with the doctor could be useful, or connecting with information to find out more information about what the concern is that the person's identified. So there is, the cards are used, they can be used in so many different ways, but there is an accompanying activity that's been designed, and that works in this way. So the 3 cards down the bottom are pile cards. And so you'll notice on the left, on pile 1, they're the things that the person would like to talk about. So they might be the cards that the person sorts and puts into that pile to set the agenda for the conversation. There's also things that they're currently managing. So they're the things that the person has is already taking care of. So it might be managing their diabetes, or they're already seeing their dentist and regularly visiting, and so they'll put those things in that pile. And then the third are the things that people identify as not a priority. And so people sort those cards into each of those piles, and you'll notice, so for example, in this example, the person's indicated that they've noticed something on that card around going to the toilet and their teeth and gums. So that now sets the agenda for the conversation to discuss with that person what their concern is, what the next steps might be, and who could support them to do that. At the time of introducing the health check-in, we really wanted to continue to evaluate a lot of the resources that we're offering and to build up our knowledge of their usefulness and effectiveness. With COVID and things sort of closing down for some time, physical health cards have not been able to be used as frequently as we would hope, because they're actually sort of a physical elastic band as well. They're actually a physical resource. But what we have been able to capture before that was that of around 300 people who had used the physical health cards, 75% reported that after using the cards that had helped them to identify a health concern. And so that's really exciting. That's quite consistent with the internal evaluations we've done early on of the cards, that, you know, they do support people to notice things that they hadn't thought about before using them.
Jade, I might just take Chair's prerogative here and just say, this has been profound for some of the districts who, you know, there's a story there of you presenting this in March last year, and someone being at that conference. And then I went back to another conference in that state in November of that year and had transformed that service that was really struggling, and had really changed the lives of not only the clinicians, but the, you know, the people with the experience of mental illness. And what I love about this is that it puts the power in the person's hands. Like, they choose what they want to talk about or what are not priority. And there's all sorts of reasons why people might choose not to do something about a health issue at that moment. And this respects that, and respects the expertise of the people with the lived experience. And I just think this is tremendous. I'd love to do some research on, or someone to do some research on this impact of this on person's empowerment. But I just think this is a very powerful thing in opening up a conversation, but where people have the power to make the decisions about their physical health journey. So, you know, congratulations with it. Now I'm going to segue to a question. This would lend itself to a screen, an app where you could just drag the cards into a different pile.
We've certainly thought about that. Yeah, definitely. Yeah.
And that way you just have to clean one screen between clients and not 33 cards.
Yeah, that's true. That's true. Thanks for that feedback, Russell. I think I agree. I think the way the cards have been designed, where, you know, we go back to what Vicky and I were saying earlier about person-led services, and people setting the agenda for the conversation, and even going back to something that you said earlier as well about, you know, starting where we can, and it's the same. It can be really overwhelming, particularly for people who might be experiencing not just one health issue, but often multiple. And the thought of embarking on making changes to your health, you know, let's start with the things that people feel that they're ready for and confident to address. And you know, that works to build people's confidence and self-esteem. It opens up a larger conversation. If people feel that they're making progress in that particular aspect of their health, it might be improved fitness, energy levels, their sleeping might have improved. It can really give people the confidence to tackle some of the harder things, which might be stopping smoking, for example. And so starting where the person wants to start is a really crucial part of the cards, and how they can be really beneficial. So whilst we don't have an app, we did develop the physical health website, and it was developed to complement the cards, but it can also be used as its own tool or resource to review your health. That's a bit of a snapshot of what the homepage looks like. It's all sort of quite condensed, but you'll notice actually that the pictures directly match what's on the cards. And so the idea is that they were to be used with the cards, and so it provides access to information specific to the needs that the person's just identified in that pile that they want to talk about. So it's about, I've noticed these things, and now let's try and find some information and take action and respond. So I'll just highlight some of the things. So the example I've got here is hearing. So if hearing was raised during the physical health cards, the person can go to the website, match the picture. There's a reminder of what the prompt questions were just here. And just below, there'll be a list of organisations and services that are specific to hearing. And they're just sort of the major sort of peak organisations. It's a stepping stone, it's a starting point for people to find more info. You can't see it on the screen, but when you do hover over the links, what they offer is highlighted on that right-hand side. And so the examples there are information resources, information about different schemes that might be available, how to book a free hearing check. So you know that if you go to those websites, you might be able to find some links to that sort of information. Okay. I'm just going to also just mention the My Health Needs to-do list as well, because this really does help bring together the physical health cards and the website. And we talk about people taking action and supporting people to take action when they do notice a risk or a change. It's really, really important. So this is an example of what it looks like. It's just a one-page folder, an A4 page, and it's a to-do list. So on the inside, on the left-hand side, it's a list of the health needs that were covered in the cards and on the website. In the middle is a column. People can tick or cross the area that was of concern, and they can choose to write the reason why it was a concern. And that's a reminder for people. It's a resource to plan for an appointment after you've reviewed your health using the cards, so that people do say that sometimes once they get into the doctor, they have trouble remembering exactly what it was that they wanted to talk about, or forget important detail. I think we've all been there. So this is just a one page, just as a bit of a reminder and a bit of a note, and people can take that with them to their doctor. That's not something that we keep. All of that belongs to the person. And on the reverse, there's just another option. So people might want to draw a picture or write down what they'd like to talk about, the reason why. And importantly, when I saw the doctor, what they said. So a space to be able to write down what people said. Like when Vicky was talking earlier about, it might be the results of something. So people making a note of that, and they can look that up and find out more information about what it might mean to them. So it's just another tool for people to take along to use. So I'll just move quickly now through I'll just mention our quarterly physical health promotions. These are locally developed and led to respond to local needs. So across the service, we encourage services to deliver 4 physical health promotions a year. And some services will combine. Some of our services will get together and deliver and co-deliver health promotions. The pictures there give a bit of an idea of some of the popular topics, but the topics are developed based on needs that have been identified by people locally. And it could be things like access to information, such as connecting with dietitians and maybe having a guest speaker come from the local health district or another service to deliver some health information and education. So in the last financial year, there was about 58 physical health promotions that were run in the last financial year. And a part of that is encouraging those local services to connect with community organisations as well to deliver. So we're really trying to get out there in the community and make those connections, because that really helps us support people who are accessing our services if we know people in the community who can support them, and a name and a face to go to for more information. So some of the most popular health promotions are always exercise and keeping active. So people are really looking for strategies and ways to be able to do that. And so we've definitely referred people, Flourish Australia, to activate with Neami, who have developed things. So there's also partnership already that's happening there. But it's wonderful that we can support people to access those programs too. You know, personal health and self-care, personal hygiene, staying hydrated, summer health and summer wellness and winter wellness are always popular topics that come around seasonally as well. So that gives us a bit of an idea of what the things are that people are interested in learning more about too, and can help us focus future services and resources when we identify those needs. And I'll just quickly finish on just some projects and partnerships that we're currently working on. This is our Art Behind Eating group, which was developed with our community arts coordinator, and it's quite a fun and different way to talk about food and nutrition. Talks about how we add colour to our meals, what a portion might look like, and people sort of can paint and draw the things that they enjoy eating. People can use it to eat, but we do find that people like to actually display it and not actually use it to eat, but that's okay. People can use it however they choose. So that's our Art Behind Eating group. We're doing some work with the University of Newcastle, as is Neami, looking at the provision of preventative care in CMOs, and so that's a really exciting partnership that we're doing. And I think a few of the team are actually in the webinar today, so I'll say a hi to them if they're listening. I really enjoy working on those projects with them. And we just recently received some funding from the Community Mental Health Drug and Alcohol Research Network to do some work in alcohol-related supports and the co-occurrence of mental health and alcohol use. We're really looking to improve the services and supports that we currently offer within the organisation, which is an area of focus at the moment.
Jade, we might just
that was it.
Yes, perfect timing. We've just got, there's so much there. We'll keep the site open so that you and Vicky can respond on the Q&A, and we'll try and get these posted into our website because there's so many issues there, and we just don't have a time in the last 2 minutes to cover them.
Oh.
But I think my question to you is a process question, which is, you've got 30 seconds each. People who want to make changes in their service to enhance the physical health and support people living with mental illness, what's your one most important piece of advice? Where to from here? Next step.
My one piece of advice, do you want to? Would be to listen to the people who you are providing services and supports to, because they actually hold the solution. The lived expertise and perspective and knowledge that people accessing the services can bring. It's just about listening to it and hearing it and privileging that voice would be my...
Yeah, and I truly believe that we need to have people that are passionate about it, staff that are committed to that particular improving the physical health of people living with a mental illness. If they don't believe that it's not going to work or happen or whatever, they just won't put the time and effort into it. So you need the staff that are committed.
And in a sense that might be, it's a roundabout way of answering, I think, one of our last questions from Patricia, which is, how do we support people when, to get these services, etc. And I guess one of the first things is to listen. If people are asking support in terms of peer support or advocacy to get a decent service, then that's the passion from all the service providers, to listen to those challenges, because so much of the Q&A is about the challenges of getting equity of access to physical health care for people who live with mental illness. Listen, I think that's probably a great spot to finish, and we're right on time. So just on behalf of Equally Well and the Australian and international community, we will post the contacts, and we'll post this. So I just want to say thank you to Vicky and Jade for, one, your great work, and two, a very stimulating and incredibly full presentation. So thank you, and good afternoon all.
Thank you, everybody. Thank you. Thanks for having us.